I'm going to take you live to Brisbane, where Health Minister Yvette and Chief Health Officer Dr John Gerard will be providing, or are providing rather, a COVID-19 update.
In our retail settings, and it is mandatory for staff to be wearing their masks in hospitality. Now, I know for many people across Queensland, this is a first to have to wear masks, but it is so important, and we know from the past that they do work. Now, we're seeing about 2/3 of the population probably complying with those rules at the moment. It's not fair to those people who are doing the right thing, for those not wearing their masks, to let everyone down. So please put your mask on. And I know I said this a few months ago, and I'm going to say it again. Wearing your mask under your chin is not wearing a mask. It's not going to keep you safe. So please, wear your mask properly, make sure it's covering your nose. Of course you can take it off to eat and drink, but it's so important that where it is mandatory, everyone is complying. Mask rules will be enforced, and also remembering that we strongly recommend wearing a mask while you're entering and exit hospitality venues as well, or any other venues indoors where there is a risk and you cannot socially distance. It's really important. We know it's going to be particularly important over the next few days as large gatherings of people come together for Christmas and Boxing Day and as we lead into the new year. The Chief Health Officer will talk a little bit more about our cases. I'm pleased that our numbers needing hospitalisation are still very, very low in this state, and that's a reflection, of course, about our high vaccination rates as well. But we know people can get sick from this virus, and it's important that you get vaccinated to keep yourself as well as possible, and of course your loved ones, and slow down the spread of this virus in the community. But we've had 32 of the 77 local government areas of Queensland now had positive cases show up since the 13th of December, since we opened our borders. 32 of the 77. And that just reiterates what we've said all along, which is the virus is going to come to every single community in Queensland. How prepared we are will be dependent on how compliant people are with the rules that we're putting in place, and of course our vaccination rates. So as great as the vaccination rates are, that isn't consistent across the state, and we still expect and require people to come out and get vaccinated as quickly as possible to get that protection. The other thing I'm announcing today is our next phase in the strategy to manage COVID as it spreads throughout Queensland. And that is our COVID pathway. Now, this is how we care for people in the community and in our hospitals. Our COVID care pathway is there for everyone to see on the COVID website. You can find many, many materials about how this will be managed for clinicians, but most importantly for the public. How can you prepare yourself for becoming positive with COVID? And there are fantastic materials and a toolkit prepared. So think of it this way, Queenslanders. You need to get ready for COVID. And by getting COVID ready, you're doing the same as we prepare for our bushfires, for our cyclones, for our floods that we do every year. We get ready for storms. Now you need to get ready for COVID. And we have toolkits, materials that are prepared for people to tell them what happens when you get a text saying you're positive. And the text is being updated and will change today to not just talk about being isolated, but link you to the materials. So you know what happens next when I get a text saying I'm positive. There'll be 10 things you can do to get ready for COVID, including preparing a Get COVID Ready kit. Things like having a thermometer at home, pain relief, regular medications, a plan of who may look after your children if one or both parents end up unwell and needing hospitalisation. And this is something we've particularly learnt from interstate, where there are situations where both parents ended up hospitalised. So don't wait until you're both sick. Plan now who could care for your children if you do need to go to hospital. Having masks and hand sanitizer and gloves, and also making sure you've got enough essentials for 2 weeks at home. So all of these materials are now available on the website, There's a My COVID-19 Symptoms Diary, so you can track your symptoms if you're being cared for in the home, and also what will happen if you need to go to hospital. This is a great step forward to help empower the public to understand exactly what will happen if you get positive, but also how to plan for that to make it as smooth as possible to help you feel confident that you can stay at home if you're unwell or if you're not seriously unwell and needing hospitalisation, and what to look for symptoms. Of course, the message is very clear. If you become very unwell and you're concerned at all, you should call 000 and go to the hospital. I want to thank our consumer networks, our general practitioners and our hospital and health services who have helped us co-design all of these materials that are available and we are launching today. This will prepare our hospitals to go forward. This will help the community understand what it means for them to get COVID, and will help everyone plan and manage their illness if they do end up with any symptoms as we go forward. I just want to again thank everybody for all of the hard work, all Queenslanders throughout 2021, and wish you all the best for Christmas. So I hand over to the Chief Health Officer and hear a few more about these cases. Thank you.